Coronavirus or the COVID-19 is a type of virus that leads to respiratory illness. This virus was said to be originated from Hunan Seafood Market in Wuhan during December 2019, and since then, the virus has been spreading throughout the world. According to scientists, it is highly likely that the virus first came from bats. However, the actual causes of the virus is still uncertain until today. Unfortunately, up until this day, no vaccine has been found yet that can fight the virus. However, to prevent ourselves from getting the virus, we must frequently wash our hands, practice social distancing, and wear masks.
COVID-19 has brought a disruption to the globalized and interrelated world.
The challenges of the COVID has brought to the tough period to all countries over the world, both in terms of human sufferings but also the damage done to the political and social. But before the pandemic, globalization was already in retreat. When COVID-19 affected all over the world, the number of cases arise rapidly every day. Insufficient hospital equipment and facilities for the patients and frontliners leads to the other implications. As the cases increase in Malaysia, hospital has limited available spaces toward the infected person and lacks of medical equipment to treat the patients. The shortage could have endangered the health of the frontliners. At the beginning of pandemic, Malaysia admitting travelers from China to enter Malaysia without realizing how serious COVID-19 can leave bad impact to the country. Government of Malaysia pay more focus on the political crisis with believing that the disease will not badly spread in Malaysia. However, Malaysia began to panic as the number of cases keep increasing from the beginning of the March. As the cases keep increasing, the government imposed the Movement Control Order (MCO), which requires all the small medium enterprise and big company to close down their operation during MCO. The arising of unemployment in Malaysia because some company lay off their employees to cut the costs and expenses. It also contributes to the increase of poverty in Malaysia. The shutting down orders for all government and private premises except for essential services leads to the downfall of the overall economic performance. Since Malaysia popular with its great holiday package and tourism, banning of travelling from entering country contributes to the lower economic profits and GDP.
So now, let's proceed to the solution implemented by public sector. In Malaysia, there are so many public sector that involved in fighting the COVID-19 such as Ministry of Health, Ministry of Finance, Penjana Initiative, and so on, and each of them provide different solution for that pandemic.
So, the first one is Ministry of Health. What the Ministry of Health do is that they enforce the health screening at all points of entry to prevent disease transmission. By doing this, they can identify the person who have the high chance to be infected by the coronavirus. Not only that, they also increase the number of hospitals that could treat the COVID-19 cases as the number of patients increase and the existing hospitals is not able to treat all the patients. Besides, they also set up a special fund known as the COVID-19 Fund to raise money to be channeled to patients, particularly those affected financially due to quarantine procedure. They also set up a provisional hospitals in the Agro Exposition Park Serdang in coordination with the National Disaster Management Agency. It was set up to ease congestion at desert COVID-19 hospitals by accepting low-risk patients who only show mild symptoms of the virus. The next one is Ministry of Finance. So, Ministry of Finance introduced the Prihatin package amounting to more than 250 million to support SME in retaining their employees. Next, Penjana Initiative. Under Penjana, the government provides several incentives to achieve Malaysia economic recovery such as wage subsidy program, special aids for childcare center, Penjana Kerjaya and also e-Penjana. Basically, wage subsidy program was being introduced to assist the people, businesses and economy to face the upcoming challenges post-COVID-19. Next, Ministry of Communication and Multimedia also involved in providing the solution during the pandemic. So basically, they come up with the idea to implement the Info of Wheels initiative to disseminate information on the COVID-19 pandemic. Not only that, they also introduced My Sejahtera application to ease the public to monitor their own health status during the period of movement control order. My Sejahtera also allow users to conduct personal health self-assessment, and it enables the Minister of Health to obtain early information of their status for further fast and effective action. For the Ministry of Tourism, Art and Culture, they restrain people from going holiday to overseas to prevent the spread of COVID-19. Besides, they also increase the domestic tourism. Next, Ministry of International Trade and Industry. Basically, they allow several additional economic sectors to operate in basis on condition of strict adherence to health and safety guidelines. For example, they allow the business of the GrabFood and also Foodpanda. For the Ministry of Higher Education, they introduced the ERTL, which is the online learning classes, to replace the physical classes to ensure that effective learning continues even though during the pandemic. Furthermore, they also consult with the airline to seek their cooperation in allowing students to reschedule flight they have already booked as the flight ticket of the students was burned because of the pandemic. Ministry of Defence. So, Ministry of Defence enforced the movement control order starting on the March 18, 2020 to break the chain of COVID-19. The last one is Ministry of Human Resource. During the pandemic, they provide the solution by assisting the re-employment of local job seekers who have been terminated following the COVID-19 outbreak. Not only that, they also require the employers to register and contribute to Social Security Organization, which is SOCSO, under the Employment Injury Scheme.
So, let's look at the last section, which is the recommended solution. The first solution that can be done is engagement with SMEs and the relevant government agencies. This is necessary to ensure that constant review of the effectiveness and sufficiency of government policies in dealing with the effects and after effects of the MCO and COVID to facilitate dynamic and appropriate responses. For example, government agencies might want to involve SMEs in the procurement process by allocating some contracts to them. Another example is introducing COVID-19 Act to protect both parties, as there will be numerous legal consequences after lifting the MCO. There is high risk of forfeiting the rental deposits and evictions. Hence, the Act will very much helpful to secure the rights of both parties.
Opportunities for hiring and upskilling staff to ways to go digital. The initiative was announced at a virtual conference on SME centres, which are one-stop shops for local firms to get business advice and access to government schemes.
Secondly, paying attention to mental health issue also is a very important initiative, need to be considered, especially during the MCO.
Government might want to increase the mental health support service in recognition that many public servants are carrying an increased emotional burden linked to their duties and personal situations. Agencies might implement initiatives taken by the Netherlands. They have developed an online toolbox for public servants about working from home and maintaining work-life balance. Lastly, government agencies should contemplate maximizing the utilization of agricultural land and offer incentive to urban agriculture, as many workers has been laid off and some of them being placed on unpaid leave. Thus, government may consider to maximize the utilization of agricultural land. In line with that, they can offer incentive in developing new fertilizer innovations, such as green fertilizer. Specifically, it can be seen that paddy industry is the most affected by the pandemic, as their performance has declined. Hence, the new incentive offered by the government helps them in increasing the paddy production sustainability. On the basis of that, this would contribute to a reduction in unemployment rate and crime rate.
In conclusion, the outbreak of COVID-19 pandemic appears to have a major impact on the economy, trade and tourism industries. In Malaysia, it has also affected the education sector, where national examinations such as SPM and STPM has to be postponed to 2021.